In previous videos, we talked about what is GERD, as well as symptoms of GERD. In this video, we will talk about some of the long-term complications of GERD. Developing these complications is dependent on how well your GERD is managed, and those with poor control are more likely to develop long-term complications than those who manage their GERD well. For this reason, even though GERD by itself is a relatively minor issue, it is something that individuals should work on with their doctors to manage on a long-term basis. In a previous video on the symptoms of GERD, we talked about how stomach acid can reflux from the stomach into the esophagus. The stomach acid irritates the esophageal walls, which can lead to symptoms such as heartburn, as well as difficulty swallowing or dysphagia. The technical name for this irritation of the esophagus is called esophagitis, and is one of the long-term complications of GERD. Sometimes, the irritation of the esophageal lining can cause narrowings in the esophagus. These are called strictures. This irritation can even cause decay in the esophageal lining, which are called ulcers. Both strictures and ulcers are both long-term complications of GERD as well. Constant irritation of the esophageal lining by stomach acid can also cause the cells lining the esophagus to actually morph and change. This is called Barrett's esophagus. This is significant because the changes to these cells make them more likely to develop esophageal cancer down the road. So to repeat that again, the most dangerous aspect of GERD is that it can lead to changes in the esophageal lining, called Barrett's esophagus, that increase your risk of developing esophageal cancer. That does sound pretty scary, and for good reasons. However, I do want to emphasize that while this is possible, the probability of it happening is fortunately low. For example, the number of people with GERD who have Barrett's esophagus is generally estimated to be 1 in 15 to 20 individuals. That means for every 15 to 20 individuals with GERD, approximately 1 will have Barrett's esophagus. For people that are known to have Barrett's esophagus, their yearly risk to develop esophageal cancer from Barrett's esophagus is estimated to be 1 out of 200 individuals. So out of 200 people with known Barrett's esophagus, only 1 will develop esophageal cancer per year. Lastly, in our previous video on symptoms of GERD, we mentioned that the larynx is close to and actually connected to the esophagus. The larynx also leads to the lungs. Long-term reflux of stomach acid into the larynx and even to the lungs has been associated with several long-term consequences such as chronic cough, worsened asthma, harsh voice, and various lung diseases such as interstitial lung disease. In this video, we have discussed several long-term complications of GERD. These include esophagitis, ulcers, strictures, Barrett's esophagus, esophageal cancer, worsened asthma, chronic cough, and lung disease. Fortunately, an individual with well-managed GERD is less likely to develop these complications, which is why it is important to work with your doctor to treat your GERD on a long-term basis.